I always wanted to come back and work in regional Australia and knew the Coffs Harbour region as had spent lots of time there through my training, and a job was available in Grafton. So here I am.
Welcome to CUC Clarence Valley. Join me today as we talk to some Clarence Valley locals and learn about their educational journeys. Come discover your future CB.
So my name's Jessie McKenna. I'm a paediatrician, so that's a doctor that looks after children and babies, so from birth all the way through to 18, and I work here in the Clarence Valley. So I have always wanted to be a paediatrician. I think I have memories of being 5 or 6 years of age and always wanting to do this, so I had my heart set from a young age. I approached high school thinking the whole time, how do I get the best marks to be able to be a doctor? So I tended to focus on choosing subjects that I thought would be helpful, such as, science-based subjects that I thought would help with getting a good mark. And I was pretty dedicated in high school and worked really hard. When it got to applying for unis, I applied everywhere across Australia because I was happy to do medicine no matter where I ended up. So I think I had to have a really open mind to be able to do that. I really wanted to do undergraduate medicine. I had a plan B to pursue maybe a physiotherapy or other sort of degree and I guess come in the back door to medicine if I had to, but I got a place at UNSW, which was based in Sydney. So I left my family in Brisbane, moved into college at UNSW at a young age and started my medical school there. That was a 6-year undergraduate degree, and I ended up doing the last 4 years of that degree at a rural clinical school based in Coffs Harbour, and I finished my degree there. And then I started an internship in Tweed Heads and basically moved around every year or two, living in lots of different cities between Brisbane and Sydney to finally become a specialist paediatrician. And once I finished all my training requirements, I moved to the Clarence Valley. I always wanted to come back and work in regional Australia and knew the Coffs Harbour region as had spent lots of time there through my training, and a job was available in Grafton. So here I am. When I left school, it was definitely an adventure. So I had just turned 17 when I arrived at college. I think living in a college was a great stepping stone because I was on campus and was instantly living with other people that were in the same position, often from either different cities or regional parts of Australia that needed somewhere to live. Starting medical school was pretty challenging, a lot of time and effort, a lot of lectures, but again, living on campus was really helpful to facilitate that. I think during my training, I knew I always wanted to end up in paediatrics, and that was a pretty tricky specialty to get into. So throughout my training, I was looking for any opportunity that might help me get more paediatric time and get onto a paediatric training program. I definitely pursued some of the opportunities myself. I wanted to get out of the city and always wanted to be in smaller places like Tweed Heads or even Newcastle. And the university has lots of options, and lots of the training programs in medicine down the track do as well, to give you opportunities to live in different cities. So I think you just have to be really open-minded, but I was always willing to go somewhere new and see what I thought of that town and try that out. My job in a regional town like the Clarence Valley is so different to what I would be doing if I was living in the city. So I get so much variety day to day. I work in a small team and I have really great relationships with the other members of the team, and I get to know a lot of the staff at the hospital really on a personal basis, which makes it much easier to turn up each day and work in a team where you feel really comfortable and you know everyone's skills. I love the variety with my job. I, run from deliveries and help babies at birth to seeing kids in the emergency department to seeing kids with asthma in an outpatient basis. We have to do retrievals and deal with really sick kids sometimes living so far from the hospital. So I really love the variety. I'm always kept on my toes, constantly jumping from thing to thing, and I like that no 2 days are the same. I also I have a lot of work-life balance here. I feel like I've got an opportunity to be a part of the community and work with the community in a number of different ways, and I love that part of living in a small town. Key skills I use every day in my role as a paediatrician are critical thinking and adaptability. So I guess those skills, alongside other skills you're constantly using on a day-to-day basis. I guess common things are common, but also really unusual things come into work. So I'm constantly, when I'm taking a history and examining patients, critically thinking about what might be going on, but also what alternatives might be there. You have to be adaptable because babies and children don't always follow the rules and don't do what you ask and don't like having procedures. So we are constantly modifying what we're doing and working with both the child and their family. And families are often really stressed as well. So being able to kind of adapt what I'm doing to fit with that family as well. I think any teenagers interested in pursuing a career in medicine should feel really excited. There are so many opportunities out there to pursue different career paths within medicine, and it's a really rewarding, exciting job that can be whatever you want it to be. I think you just need to be open to working really hard and be aware there's a big time commitment, but you can achieve anything you want to if that's something you're passionate about. I think in life, if there is something you really want to do, there's often multiple pathways to get there, and things might take a little bit longer than you first planned. But if it's something you're really passionate about, there are ways. I would encourage people to continue with their learning and think about bridging courses or other pathways to increase their knowledge about the subject and to be open-minded to what other learning opportunities there are. There's also lots of careers where you can work in health and work with families and young people and not be a doctor, but still be a really crucial part of their kind of therapy team or team helping them get better. So there's lots of opportunities for different career paths that are part of medicine, not just being a doctor.